This is part 3, Tricking the Brain, Mirror Box Therapy for Phantom Limb Syndrome. So what is phantom limb syndrome? Well, first off, a phantom limb is a limb that is no longer there, but that's still causing some sort of sensation. So you can picture that this individual has had this particular limb removed. Maybe they lost it in an accident or in a war, or maybe they lost it through diabetes. Sometimes that happens with feet. Or maybe they lost the limb from gangrene or some sort of an infection. But for whatever reason, they no longer have this limb. And it would be quite natural if this person, when this limb was amputated, had pain at the amputation site. So that kind of pain that's present while the body is healing from an injury or from surgery is very natural. That kind of pain can be treated. However, when someone comes in and they're talking about pain, and they're not talking about it at the amputation site, but they're talking about it, let's say, in this person's, right thumb or right wrist, this person says they're experiencing pain. What can the doctor do with this? This is a very difficult condition to treat because there's not any limb there that the doctor can deal with. And so this was a very flummoxing thing for many doctors for quite a long time. How do we treat pain in a limb that doesn't exist? And so in order to understand the treatment model that we will be looking at in mirror box therapy, we need to understand how the body is represented in the brain. So let's take a look at this image, which is, we would consider it to be called the homunculus, which is the representation of the body within the brain. And this tiny image at the top is an upper view of the brain, and it's showing you what is represented in the lower images. So this red streak in the upper, in this upper image is representing this red region below. And this is the region that is our efferent nerves. So the motion is going from the brain to the limbs. So, for example, giving your brain sending a signal to the hand to grasp onto something. That's happening in this region. The blue region is the region corresponding with the input from the body to the brain. And so these are afferent nerves, or nerves that send information into the brain so that a person can experience sensation in that part of the body. And so in order to move your thumb, this particular region is active, these efferent nerves. And in order to experience, when you just injured your thumb, that's coming in this region. The odd shape of the body that's shown on the outside of both of these is the corresponding region of the brain dedicated to that part of the body. So for example, we have to do a lot more precise motion with our hands than we do with our feet. So this part of our brain we have a lot larger proportion of our brain dedicated to sending information on how to use our hands and how to use our feet than is dedicated to more information on how to use our hands than how to use our feet. And you can see there's a lot of information on just controlling all the small muscles in our face that allow us to have facial expressions. So our brain dedicates its regions to where we have the greatest need or use. Similarly, the receptors that allow us to experience sensation in the body differ according to need. So we have a lot less sensation in our trunk. Look at this tiny little region. This is the whole body. This is the neck and the upper body and the butt and the legs, and just this little bit of region devoted to experiencing sensation in this part of the body. There's quite a bit more contributed to experiencing sensation in the foot, a good deal more to experience sensation in the hand, and of course the face, limbs, the tongue, and so forth. So what's happening here? Well, and this is the region devoted to the hand, and this person now has lost their hand, their whole arm. But this region of the brain is still there. It's still there looking for input from this part of the body. And understanding this brain map will help us to understand what's on the next slide. So when does phantom limb syndrome occur? So it occurs when a limb is injured, and maybe it's immobilized for a period of time. So a person has injured their arm, and then maybe it's in a cast for a while, something like that. And so the limb doesn't recover, it's eventually amputated. The brain, all it's received is a little bit of afferent input, but it couldn't send any movement signals because the limb was mobilized, and so it kind of froze in that pain modality. So this person was injured and their arm was stabilized, and so because the limb hadn't been moving for a while anyhow, the brain doesn't recognize that the limb is gone now. It's no longer immobilized. So that's one pathway through which phantom limb pain can occur, is just simply that the brain doesn't recognize the limb is gone. The last experience the brain had with the limb was an experience of pain, and it got stuck there. And so the experience of pain persists in the brain even if the limb itself is gone. And so now we'll be working a lot with this Dr. V.S. Ramachandran, who, when his own father suffered an accident, he was a neuroscientist who then began to explore pain in the brain in order to help his father. And he discovered a mirror box technique, a very, very simple device. I made one myself, in fact, so that students could have the experience of the mirror box. And it's really quite strange when you use this box to trick your brain. You would be willing to swear that you are moving a limb that you are not moving. So it's easy to trick the brain, but it takes a very wise scientist to figure out that this can be beneficial. And that is Dr. Ramachandran's contribution. So the mirror therapy, you are going to watch a video on it, so I'll give this brief explanation, but I want you to watch the video because it's much better. But in a nutshell, this is a person, you can see both sides of him. So here you can see that on his right side, he has lost this limb. Now we look at him from the other side, and you can see that he is putting his good leg down and his bad leg on the other side, and he's looking in a mirror. So it appears to him from his perspective that he's seeing both of his legs. And so then if he moves his good leg, his brain will perceive that he's moving his bad leg. And the ability to move it can contribute to a relief of pain. So that's my nutshell version of explaining this. And you're going to watch Dr. Ramachandran. And I have offered for you three videos. One of them is only 3 minutes long of a patient going through this process. But the other one, you have two options, and one is a rather long, it's a 55-minute full program about Dr. Ramachandran's work with phantom limb, and this is the one I recommend. And if you're not going to watch that one and you know it, I put a link to an 8-minute version of that up there for you as well. So you'll be watching this video, and I think it's helpful to understand these processes of pain as we go next week into factors related to addiction. So a brief summary of all of this work. We can have acute pain, which is rapid and intense, chronic pain, which is enduring, less intense, but it might throb and persist and seem not to end. Nociceptors send pain sensation, what we call noxious, nociceptors, noxious sensation to the brain along sensory nerve fibers. Slow and fast pathways to the brain travel independently, and each can block the other. According to the gate theory of pain, acute pain sensation can close the gate to throbbing pain, and vice versa. Opioids, which are analgesics, can be produced endogenously within the body and exogenously outside of the body. Exogenous opioids are a source of significant abuse and death in recent years. Cannabis holds promise for relief of chronic pain linked to a range of conditions, but does not offer relief for acute pain. And mirror box therapy can help relieve pain from limbs that have been removed.